Hi, I'm Maryna Al-Fauri and I will talk about the phenotypical characteristics of the middle cranial fossa. Why did I choose to study the morphology of the middle cranial fossa? Because it serves as an effective approach in treatment of small and medium-sized intracanalicular vestibular neuromas. The wide range of anatomic variability and lack of proper visualization of the internal acoustic meatus from the middle cranial fossa aspect challenges the treatment method significantly. Despite the wide implementation of the preoperative radiologic evaluation of the skull base, the range of inner ear and neurological complications after surgery is still relatively high. Although in 96% of cases this approach allows removing the tumor completely, the preservation of hearing is possible only in 51% of patients. Detailed knowledge of the individual anatomical variability of the middle cranial fossa and topographic landmarks of the internal acoustic meatus subject to the individual shape of skull would help to improve the situation. We built present study on the assumption that the cranial phenotype does influence the shape of the middle cranial fossa, the orientation of the pyramid of the temporal bone, the shape and the relative topography of the internal acoustic meatus. Our goal is to study the topography of the above-mentioned structures in brachiocephalic, mesocephalic and dolichocephalic subjects and provide surgeons with reliable landmarks. 54 cadavers and 60 magnetic resonance images of the head were included in this study, all without known osteologic pathology and visible head deformations from 52 to 78 years old, 55 men and 59 women. The dissection took place in the specialized laboratory as a part of the routine education process. Following the craniotomy and extraction of the brain, the remnants of the dura mater and cranial nerves were removed from the middle and posterior cranial fossa, uncovering the structures of the temporal pyramid. Then 26 photos were taken from the skull base with a 15-degree angle difference and uploaded to the photo modeler software for 3D modeling. The obtained 3D models underwent scaling and rotation settings, and the following measurements were taken digitally. The anterolateral and anteroposterior diameters of the skull, the width and length of the middle cranial fossa, the length of the superior border of the pyramid, the width of the base and the distance from the apex of the pyramid to the temporal squama, the distance from the upper margins of the porus acousticus to the superior border of the pyramid, the width and height of the internal acoustic meatus in its medial part. To identify the porus acousticus in the middle cranial fossa, we projected the anterior and posterior margins of the porus acousticus to the superior border of the temporal pyramid. The following distances underwent measuring. Between the apex of the pyramid and the projected anterior margin of the porus acousticus, the distance d1 were taken. Next, between the anterior and posterior margins of the porus acousticus, the distance d2. And finally, the distance between the projected posterior margin of the porus acousticus and the most lateral point of the superior border of the pyramid, the d3 distance. On the axial magnetic resonance images of the head, we have identified the superior border of the temporal pyramid and the internal acoustic canal and measured the following angles: the angle between the axis of the canal and the superior border of the temporal pyramid, and between the lateral wall of the middle cranial fossa and superior border of the pyramid. To illustrate the challenges faced by middle cranial fossa surgeons, we simulated the middle cranial fossa approach on a cadaver. The skin incision was placed at the level of the root of the zygomatic arch, 1 cm anterior to the external acoustic meatus, to avoid injury of the temporal branch of the facial nerve. Then it was extended upward along the hairline and edged forward, approximately 7 centimeters above the zygomatic arch. After the reflection of the scalp flap anteriorly, we incised the temporal fascia and detached the temporalis muscle from the cranium. And on the surface of the bone, we marked 4 bone holes as close to the posterior margin of the operative wound as possible, and resected 5 to 4 centimeter bone flap. Then we elevated the dura mater from the floor of the middle cranial fossa and retracted the temporal lobe 18-20 millimeters anteriorly, uncovering the anterior surface of the temporal pyramid and the main anatomic landmarks used in surgery. The acute eminence, the ridge of the greater petrosal nerve, and the meatal plate were identified. The cranial index was calculated as a percentage ratio of the lateral diameter of the skull to the anteroposterior diameter. All specimens were subdivided into 3 groups according to cranial index value: the dolichocephalic with value 74.9 and less, the mesocephalic 75 to 79.9, and brachiocephalic with cranial index above 80. The methods of descriptive statistics were used to analyze the average and distribution of the variables in each phenotypical and gender group. Analysis of variance was employed to verify the significance of differences. The anteroposterior and lateral skull diameters varied significantly with the sex and shape of the head. According to the cranial phenotype, 44% of the cadaver specimens had mesocephalic skulls, 37% constitute the dolichocephalic group, and 19% were brachiocephalic. The measurements of the middle cranial fossa and the pyramid of temporal bone correlated positively with the diameters of the skull. Although the inner diameters of the internal acoustic canal did not show a strong correlation with the shape of the skull, the orientation of the canal in relation with the superior border of the temporal pyramid correlated positively with the anteroposterior and negatively with the lateral diameters of the skull, with the significance of 0.01 level. The length of the superior border of the temporal pyramid, the apex to squama distance, and the width of the middle cranial fossa all peaked in the brachiocephalic group, but the width of the base of the pyramid and the length of the internal acoustic canal were prevailing in the mesocephalic group. The mean diameter of the internal acoustic meatus was relatively smaller in the brachiocephalic group. The mean distance from the superior margin of the porus acousticus to the superior border of the temporal pyramid was significantly closer to the superior border in the brachiocephalic skulls and laid about 2 millimeters lower in the dolichocephalic ones, revealing strong associations with the cranial phenotype. The table shows the dominance of D1 and D3 distances in the brachiocephalic specimens. However, the length between the projected margins of the porus acousticus did to peaks in the dolichocephalic group. The value of the angle between the superior border of the pyramid and the axis of the acoustic canal varied from 33 to 58 degrees. It peaked in the dolichocephalic group and showed its smaller value in the brachiocephalic one. The pyramid to squama angle had reversed distribution and dominated in the brachiocephalic specimens. The results of the ANOVA test confirm that the above-mentioned differences in variables between the cranial phenotypes and sex groups are statistically significant. We have found that the shape of the middle cranial fossa correlates positively with the lateral diameter of the skull. The brachiocephalic skulls possess the larger length of the superior border of the temporal pyramid, the distance from the apex of the pyramid to the squama of the temporal bone, and the angle between the pyramid and the lateral wall of the middle cranial fossa. On the contrary, the dolichocephalic skulls had a 4.65 mm shorter apex to squama distance and about 20-degree reduced pyramid to lateral wall angle. We would like to emphasize that the angle between the internal acoustic canal and the superior border of the temporal pyramid, so-called IAC angle, showed a reversed distribution. It was twice as larger in the dolichocephalic spacements compared to the brachiocephalic ones. These data show a clear pattern of distribution of the variables between the cranial phenotypes and can help to systemize the wide range of variability of the structures of the skull base. The findings of the shape of the middle cranial fossa, degree of the inclination of the pyramid, and topography of the internal acoustic canal in different cranial phenotypes are novel. According to our observations, the superior border of the temporal pyramid is well visible in the operative wound and may be used for identification of the internal acoustic canal in the middle cranial fossa surgery. The 3D distance shows the precise localization of the origin of the internal acoustic canal. The knowledge of the specific angulation of the internal acoustic canal in different cranial phenotypes may now be applied to project the canal to the anterior surface of the temporal pyramid. Comparing the value of the 3D distance in the brachiocephalic and dolichocephalic groups, we have found that the posterior wall of the porus acousticus is located 1.98 mm further from the squama and 1.44 mm closer to the superior border of the temporal pyramid in these basements with wider skulls. These small differences may require extended drilling in mesocephalic and dolichocephalic patients that can influence the size of the removable bone significantly. Although the structures of the skull base were all relatively larger in males, the angulation of the internal acoustic meatus and the temporal pyramid showed no sexual dimorphism among the studied groups. The studied variables showed the same pattern of distribution between the cranial phenotypes in males and females. Thus, the cranial phenotype shapes the middle cranial fossa, the temporal pyramid, and the internal acoustic canal. The parameters of the middle cranial fossa and the length of the temporal pyramid are larger in the brachiocephalic skulls. The superior border of the temporal pyramid angles from the lateral wall of the middle cranial fossa and the axis of the internal acoustic canal in a specific pattern reflecting the shape of the skull. Despite the relatively larger values in males, the distribution of the studied variables by the cranial phenotype showed no sexual dimorphism. The superior border of the temporal pyramid is a reliable anatomical landmark that may be used for the prediction of the localization of the internal acoustic meatus in the middle cranial fossa. The presented data could help in the preliminary evaluation of the patients and individual planning of surgeries on the internal acoustic meatus. Thank you for your attention.